Hello, Cameron. My name is Stephanie, and I will be caring for you today. Today, I will be doing the musculoskeletal assessment. So, at any given time, you may stop me to ask any questions that you may have, or if you feel any discomfort, just let me know, and we will try to redirect it to make you feel more comfortable as possible. So, first, we will start. I will ask you to hold your hands up. We will start with the fingers and the wrists and the hands. So right now I'm assessing Cameron's wrists and hands and fingers as well. So I'm looking at his fingers for any type of nodules, masses, redness, growth deformities, or anything out of the ordinary in appearance for that. I will next begin to start to palpate his joints for any tenderness, any lumps, checking for rheumatoid arthritis. And also, I will be noting any tenderness or warmth, swellings of signs of inflammation. So first, we will begin by doing range of motion of his hand and his finger. So first, we will do the fingers. So hold it up to the camera. So first, I will ask you to abduct, which I will ask you to spread your fingers. That's abduction, and then adduct, meaning bring back to the body. And then I will ask you to flex and extend your wrist. I'm going to ask you to flex your wrist and then extend your wrist. And then next we will be palpating the anatomical snuff box. So I'm going to ask you to do your hand like this. Hand up like this, extend it like this. And right here in between the groove, kind of stretch it. Right here, I will be palpating and pressing on this area for any pain, which would indicate a fracture if it was there. So the first test I would do will be with carpal tunnel assessment called the Tyndall sign. So we're going to ask Cameron to have his hand out, and I'm going to palpate the wrist between the ulnar and the radial. Hold your hand out. And the radial bone. And then we're going to also, while we're palpating, we're asking if he has any tenderness, any pain. I'm noting if there's any warmth, if there's any redness or anything that feels out of ordinary, like a deformity in that area. So next I'll move on to the phalanx test, or the phalanx test. I'm going to ask you to hold your hand like you're praying. And then I'm going to ask you to reverse it like this. And then you're going to push your wrists together for about 30 seconds. And by Cameron doing that, I'm noting if you have any, I'm going to ask him any tenderness, any pain while you're doing that. And if it is, it could be a sign of an issue with carpal tunnel as well. So the next carpal tunnel test that I can do would be to also test for, we were having to put his hand upside down like this, and we're also still going for carpal tunnel, and we're checking, it's called the median compression test. So we're compressing the nerves for about 30 seconds, and we're also noting numbness, tingling, or pain there in that area. Next, we will be moving on to the Allen's test, which I will have Cameron to make a fist, and he's going to put his thumb in it, make a fist. And then I'm gonna ask Cameron. So sorry, that test is not the Allen's test. It's actually the Finkelting's test, where I'm gonna ask Cameron to make a fist and place your thumb inside. And then what I'm gonna do is I'm going to extend Cameron's wrist down, and I'm noting any tenderness or any pain there, for any type of inflammation or anything that's there. Any pain, Cameron? Okay. So the next test then will be the Allen's test. So with the Allen's test, I want to check for the vascular, and it's also a carpal tunnel test that we use. So I'm going to ask Cameron to make a fist, and then I'm going to place my hand on the radial as well as the ulnar side, And I'm going to press each side. Then I'm going to ask him to release his hand. Open your hand. And note that it's white. And I'm going to occlude one side and watch how the hand begins to turn pink again. So I ask him to do it again. Make a fist. I'm occluding both sides. And then I'm going to ask him to open his hand. And then I'm going to take my hand off the other side, and the hand should turn pink again. And I will do that with both sides of his body. So next we're going to inspect the elbow. Same thing, we're going to inspect for any swelling, any redness, any deformities to his elbow. And then next what we'll do is palpate the tip of the elbow, which is the acrolein or acrylic process. We're going to start to palpate for any tenderness or any pain there. Next, we will palpate the medial and the lateral epicondyle of the elbow. So here, can you hold your hand up? Straight out. So here's the medial, and then you have your lateral. And we're also noticing for any pain or any tenderness there. If I'm not mistaken, it was the golfers that have issues here in this area with golfing. And you will do this test for any tenderness or any pain if they have an issue. So next we will do range of motion with his elbow. So we're going to ask him to do flexion and extension. So for flexion, Cameron, we're going to ask you to flex in, and then you're going to extend out. And then we're going to do pronation and supination. So we're going to do palm down and then palm up. And then next we're going to move on to the shoulder. We're going to inspect for symmetry. We're going to inspect for any swelling. We're going to inspect for any joint pain. And if Cameron came in with shoulder pain, then we would ask Cameron to remove his shirt so I could see visibly, see what's going on with his shoulders. So first we'll start by palpating around his suprasternal notch. And then we're going to move over to his clavicle to the Cromanin process. So we'll start here, right in the middle, and then we're palpating over to the left, noting any tenderness, any pain, or anything in this area of the shoulder. So then we'll move along with the range of motions, and noting that we'll do both shoulders. In this video, I'm going to do one. So the range of motion, we would start by flexion. So we would ask Cameron to flex his arm by placing it up in the air. So that will be flexion. And then I'm going to ask you to, if he was extending, then he would stand up, Cameron. And then you would extend your arm behind you to extend, just behind, like you're going to fly. And then next he will be doing abduction, which will be hands out to his side. And then adduction will be a hand across his body like this. And while we're doing this, we're continuously noting for any pain or tenderness while he's doing that. And it will mostly be with the shoulders. And then we also can do internal, external rotation. So Cameron, scratch your neck. And then for external rotation, then you're going to take your hand to your back and you're going to reach back by your clavicle and just give yourself a back rub. He's able to extend his hand with the external rotation. Okay, sit down. So continuing on, we're going to do, to piggyback on the external rotation, I said clavicle, but I meant the scapula. So moving on with some tests for the shoulders. The first test will be the speed test, where I will have him to bring his palms up, other palm. You want palms up, and then I'm going to ask Cameron, don't let me push you down. So we're checking for to make sure that he doesn't have any pain and it's not allowing him to utilize his strength to not allow me to push him down. So next we'll do the NIRS test, which I will come behind camera and I will place my hand on his scapula. And then, so I'm going to place my hand on his scapula. And then I'm going to ask you to raise your hand. Raise your hand. And then I'm going to ask Cameron to then, as far back as he can go, to make sure that there's no tenderness or any pain here in the shoulder or the scapula area. Next, we're going to look into the Hawkins flex, the Hawkins test, which he will flex his shoulder. I mean his arm across his body. Go ahead, Cameron. Don't bend. And then I'm going to slightly bend it this way. No, I'm sorry. So I was wrong. So we're going to do it this way, and then we're going to slightly give it a gentle that way. And we're also indicating if he have any pain or anything in that shoulder, which could mean like a rotator cuff or tear. The next test is the apprehension test, which we will then do. So with the apprehension test, I'm standing behind Cameron, and I will have him to flex his arm like he's making a muscle. And if he can't bend his arm there, I'm noticing facial grimaces or any tenderness or pain, then that can also mean something is going on with the rotator cuff. So next we would do the drop arm test, which we would do you put your hands out to the side. And then if he's not able to raise his hand, kind of pronate a little bit. And if he's not able to raise his hand and keep it up without it dropping, then there's a sign also with the rotator cuff. So next we will do the neck. We're inspecting for any symmetry, swelling, deformity, or any type of bulging or anything like that to the neck. And then we're gonna next ask Cameron to do flexion and extension. So for the flexion, we're gonna tell you to put your chin to your chest. There you go. So he's able to do that without any neck pain. And then we're gonna extend. We're gonna actually look back like you're looking toward the ceiling. And then we're gonna do cervical rotation. We're gonna look to the right. We're gonna turn to the left. And then we're going to do lateral bending, which we're going to do. Your ear is going to touch your left shoulder. And then your right ear is going to, go ahead, do it fine. Then your right ear is going to touch your right shoulder. Or we could have just did like a little neck motion just to test to see if he have any tenderness or any pain with his neck. So next I'm going to ask him to stand up and we're going to do the spine. So he's tall. We're doing the best we can. So with the spine, we're looking at symmetry, alignment. We want the S curvature. We're checking for trauma, deformities, or anything like that. Then we'll move along to palpate. We'll start at C7, and we're gonna walk. We're gonna walk our fingers down the vertebra, asking for any tenderness, any pain, making sure that we're noting any alignment and there's no deformities or anything that's noted out of place in his vertebra of his back. Then next we'll move along after that if everything checks out okay, and we're going to palpate the muscles in his back to notate any pain, any tenderness, any warmth, or any issue with his muscles. So then we're going to move along and we'll do range of motion. I'm going to ask Cameron to do flexion by bending forward, just bending down like you're picking something up. And then depending on why he's here, if he's he's here and if there are any back problems, then I'm going to ask Cameron to even lean as far as touching his toes. While Cameron is bending over, I'm still looking for the same thing. I'm looking for symmetry, alignment, making sure there's no signs of scoliosis or anything going on with his back. I'll ask you to stand straight up, and then I'm going to extend. So you're going to lean your back to see if you're able to do to lean back without any pain in the back area. So then we'll ask him to, and that's extension. You're going to stand straight up, and then we're going to ask him to just turn the upper body, do a little twist to the right, back to the front, and then you're going to do a twist to the left. Just checking also for any issues with turning or any indications of muscle issues in that area or even the back. So next we'll do, we're going to do a lateral bending, which will have him to kind of lean to the right. And this will also indicate if he have any tenderness to one side of the back, and then he'll go to the other side, any tenderness to the other side of the back if he's able to use his back muscles and everything there. So next we're going to have, so next in the examination, we're going to do a test for the hips. For the hips, we're looking for symmetry, we're looking for alignment, we're making sure both legs are even and there's no unevenness with the hip. So for this test, I'm gonna have to ask Cameron if he was laying down. Just sit in the chair. If Cameron was laying down straight on his back, in order for me to check his legs, and remembering we have to do both sides, then he would we'll first do flexion and extension. For flexion, we would just ask him just to raise his leg in the air as far as he can, just to see if there's any pain that is noted with the hip. He wouldn't be able to raise his leg, but so far if he starts to have any pain or any issues there in the hip. And then if he was lying down as well to check for extension, I would have him to roll over on his belly, and then he would extend his leg backwards, back up. And also that will check for any pain or any issues with the hip. So then continuing on with the hip, I will have Cameron to lay on his side. I'm going to see if I can find an angle where we can have him to do this test. So doing the best that we can, continuing on with the hip, we're going to do abduction and add with a D of the hip. So first we would have for ab with a B, we're going to have Cameron lay on your side, and we're going to have him to come on, flex your leg out. And then for adduction, I ask him to bring this leg this way. Come on. It'll be kind of across the body. You want to not bend his knee, but just across the body. We really don't have room for that. So you want the leg across the body, and we want to keep the knee away from the knee up and away from not the knee up, sorry. Just the leg across from the body. So then you will move on to internal, external rotation with abduction and adduction as well. So with doing that, you will have the patient to have his knee, let me see, turn over the camera. So for that, we would do with the knee kind of like up that way, and then that will be add, and then that way ab, just to check. Also, we're still checking for the knee. So moving along, we will also palpate the hips on each side. We're checking the anterior surfaces. We will have them to lay on their side, lay on that side, camera. And we're also palpating here. Also, we're going to palpate, noting the sciatic nerve around that area. If there's any tenderness there, we will have him to do a straight leg test if we need to, which will be him raising his leg up in the air one at a time. And then also you do the other side to notice how long he can have his leg in the air, and if any pain is noted. And that will be the hip examination. I'm not able to do all of it again, but I just want to reiterate, when we have him on his side, we're going to make sure we're looking at the nodules here. We're making sure that he doesn't have any issues with his sciatic nerve. We're palpating the hips, any inflammation, any pain, any tenderness, any redness, or anything in that nature. Okay, so we're going to move on to the knee. And we're going to also do the same thing. We're going to check for symmetry on both sides. We're looking at any deformities if noted. We're going to check for any pain, any joint displacements. We're also asking for any tenderness, any swelling, or anything noted for that. So then we'll move along to remembering that we're going to do both knees. We're going to palpate each side. We're going to do the medial and the lateral. We're palpating, we're tenderness, pain, warmth, any swelling, any edema on each side of the patella. And then we're going to also move over to the patella groove, noting any pain there. Sometimes people have pain there. As we continue to do the patella, we're going to start by palpating for any tears or damage on the lateral and the medial aspect in the meniscus grooves. A lot of people get that from playing sports. So we're palpating there for any pain in the meniscus groove of each side of the knee, one at a time. And then if we were doing the posterior part of the knee, the patient would be standing up, and then we will palpate the same way in the back of the knee. And sometimes patients may have like cyst or any tenderness or pain back there also. So the range of motion with the knee would be a flexion extension. So for the knee, you would do the same thing. You would flex out, extend in, go in, push in. Extend in, note any pain or any tenderness there. You will do abduction and adduction. So abduction would be taking your hand, placing one hand on the foot, the other on the knee, and you will be moving away from the body for ab and then toward the body for add. Next, we will test for the meniscus, I think it's called bears of the knee. And then we will place the hand on the knee, and then we will move out. We will do lateral and medial. And it's pretty much kind of like what we just did with the abduction and adduction. But we're testing to see if there's any pain in the meniscus of the knee. So this is the medial of the knee. You'll place your hand here, and then you'll place your hand on his foot. I have my hand on his foot, and I'm kind of giving the foot a little inward move to see if he have any pain around the meniscus. And then I will do the same thing to test the lateral aspect of the foot, of the area as well. But I'm going to give that foot a little twist to the outside for any pain with the lateral. So continuing on, we will do, which I don't know how I'm going to do. I think I can try to explain it. It's called anterior drawer sign. You will have the patient to lie down, flex the knee, and you're going to sit on the patient's, slightly sit on the patient's foot. You're going to take your hands and you're going to place one behind, you're going to kind of place them behind the knee, but the palms kind of on the outside, like of the patella of the knee. And you're going to give it a push, and you should feel like a drawer opening with the knee. And if there, and also still noting pain or any tenderness there. And also you can do the posterior drawer sign, which is just the total opposite. Hands are behind the knee, palms on each side, but this time you're giving a pull while you're sitting on the foot. Next, you can do the balloon, I believe it's the knee, check for knee effusion, and you're going to place the hand over the knee, and then you're pressing one side, noting if there's any fluid shift on each side. You'll go from one side to the other. Um, and also just checking for edema or anything in the knee. You'll continue to do like, little palpations up and down the knee, just noticing if there's any edema in the knee. And again, that knee effusion, doing the balloon, you'll place your hand here and just one side at a time, just checking if there's any shift of fluid. Camera doesn't have any fluid, so we won't see any fluid moving. Lastly will be the ankle and the foot. Inspecting his ankle, his foot for symmetry, swelling, deformity, noting if he has any tenderness, any pain in that ankle or that foot area. You will palpate the ankles, medial and lateral, which medial is inside, lateral is to the outside. You will also palpate the heel area of his foot. Let me see the camera if I can get it. Oh my gosh, it's so hard. This is his foot. You'll palpate the heel portion of his foot. You're also gonna palpate the top of his foot and also his toes. You'll palpate the entire foot and ankle aspect, noting any pain, or you're also gonna look at the arch of the foot. Some people are flat foot and have issues with walking or pain for that reason. So the range of motion of the ankle and foot is kind of simple, where you just place your hand here. You kind of give the foot a backward flexion and then extension kind of down. You can do abduction, kind of twist, and an adduction to the foot as well, just noting any pain. This was very difficult trying to do this assessment. I hope I touched every point. I will continue on to practice and get better. I thank you for taking the time to watch, and I hope I was able to hit every point once again. Thank you. Have a blessed day.